Hello and welcome to another episode of Homeopathy Simplified. This is episode 22, and we're going to be talking about baby's first remedies. And it's based upon a free ebook that you can download from my website. And you'll get that URL in the show notes and at the end of the display here. So this ebook acts as a guide to developing the skills needed to choose and use homeopathic remedies for the most common ailments a baby might have. It'll cover skin conditions, digestive issues, common infections, colds, flus, colic, etc. And you'll learn a lot about using homeopathy in this episode in the context of babies. So without much further ado, this is the cover. And you can see a beautiful smiling baby. That's my granddaughter. And then below, a sort of a natural condition of skin that may or may not need a remedy. And then, of course, a picture of some homeopathic remedies. So it's going to be a really useful guide. So just a bit about me. I'm Jonathan, and I discovered homeopathy through my father, who in the 60s was one of the key teachers of homeopathy and foundation of its resurgence in Europe in the 60s and 70s. So I was really fortunate to study homeopathy with his students, and I feel a real strong connection to his career. In my career as a homeopath, I also became a Bowen therapist and developed a practice focusing on pain and chronic disease. So after now 28 years, I've come full circle, and I want to share my knowledge. And I've made a purpose of teaching a course called Homeopathy Simplified that really is the one I wished I'd had in the very beginning of my career. It's a course created to make the complex simple and shine a path through a forest of ideas and misconceptions about homeopathy. So here's a picture of my father in a very cool Western hat. He used to love Westerns. And he passed away in 75. I was 12. And so my introduction to homeopathy was as a kid. In fact, I remember going to his classes in London and sitting in there. And I must have absorbed something in those classes. Anyway, this is not the slide I wanted. This is the one I want. We're going to cover conditions listed here: colic, rashes, constipation, teething, colds, and coughs. And this will be a kind of general introduction to how to use homeopathy for the newborn and toddler. And often they'll have those conditions in the early stages of their development, as they develop their immune system, as they develop their digestive system. And it's just a short list, and yet these illnesses can be an enormous burden on a new parent and even seasoned parents. And for them, the suffering of our vulnerable newborns is such a stress. And so having a tool that helps you choose a reliable and helpful remedy can quickly calm the concerns of every parent who uses them and make it a more, calm time for everyone. So I'm going to just run through how to use this guidebook. And, step one is always about identifying what are we actually treating. Does this condition truly need to be addressed? And we all too often want to fix every little problem when really a little patience or a little management, maybe positionally, maybe time, maybe little factors that you can apply as a parent for a newborn can resolve those troubling issues. And we often assume a one-off symptom like constipation is immediately needing to be addressed. And that's not necessarily true. So, some newborns will, have 2 bowel movements a day, and others not for 10 days regularly. So, for example, when a baby's been fussing following nursing, rather than assuming the baby is ill or worse, we can question the circumstance leading up to the fussiness, and it might have been the meal the mother ate the night before, where it was laden with spices or garlic that she, didn't know would affect baby. Or baby gets hiccups, in fact hiccoughs, most times following nursing. And we often see, newborns with acne. These are all symptoms of their developing systems and shouldn't necessarily need treating unless it becomes problematic. And then step 2, you'll see a series of charts that help guide the choice of a remedy. And they're essentially simple questions that you answer yes or no. And if a clearly chosen remedy is the result of using the flowchart, you can assume it would be a good choice based on the characteristics of the medicines and the symptoms of the child. So at that point, you would refer to what's called a materia medica, basically a pharmacopoeia, a book describing the symptom indications of a remedy to ensure it fits the whole story of their symptoms. And then you would choose a remedy's potency and strength, and there's a good chapter there, we'll cover that too. And always observe the effect of a remedy before repeating it, despite label instructions. I don't know why, but a homeopathic remedy in North America and probably Europe has to have a dosing instruction, which makes sense, for normal medicines, but homeopathy isn't normal. It's not like a drug. It's a stimulus. It's a greeting to the pathology saying, hey, you better behave and work this out. It's an authority figure, and it doesn't always need to be a nag in that sense. So you don't need to keep repeating the remedy. So these are the remedies covered in this guidebook, and there's a few extras that I'll talk about. But these are basic remedies in homeopathy. Most of these, if you know anything about homeopathy, you probably already have them. And so having a better understanding of how to use them is worthwhile. So these first 4 letters here in number 1, acon, is the abbreviation, the official abbreviation of the remedy. And the full name is written afterwards, aconitum napellus, arnica, arsenicum album, belladonna, bryonia alba, calcarea carbonicum. And sometimes you'll learn in homeopathy there are many calcareas. Calcarea sulfuricum, calcarea arsenicum, calcarea silicatum, and so on. Calcarea muriaticum, calcarea phosphoricum. I just had lunch. Chamomile. Chamomilla vulgaris is the herb, chamomile. And in homeopathy, we almost use it in the opposite way. Even though herbally it's very calming, we would give it to someone who is really agitated. Lycopodium clavatum, nux vomica, phosphorus, pulsatilla, silicatera, and sulfur. So these are the main remedies we're going to cover today. And this is the flowchart that I was talking about. So we can see that this is for colicky babies, some digestive issue perhaps, some breathing issue perhaps. We don't know. We don't know if it's a diaphragmatic issue, and so therefore a remedy may be appropriate, or perhaps even a physical therapy for colic. In fact, I have a video on YouTube for colicky babies, treating them with Bowen therapy. And it's actually my most popular video, so I'm sure this is going to be even more popular. So we would ask the question, is the baby eating and drinking normally? If it's more, we follow the path. We then question their mood. Are they mild or are they irritable? How are they affected by touch when they are mild? And how are they affected by touch when they are irritable? Are they aggravated or ameliorated? And this is how we can question, and maybe it doesn't fit. So if this pathway doesn't work, don't use it. And find another way to get a remedy. We won't always have answers to the questions needed. And these are just a group of 3 or 4 questions per chart. So it's very general. This is not anything more than a way of helping you, the general consumer and part-time practitioner of homeopathy, to help you choose more wisely. So eventually we come to a choice of remedy. So we go to the opposite side, diminished appetite. They're not eating, they're still sweet and happy, or they're grumpy and irritable. We would follow these. And there's a specific one for you can only carry the baby. That's all they want. Again, the same questions. How are they when they're touched or held? Are they aggravated in their mood or even in their symptom? And you can see some difference there. I'll just talk a little bit about the remedies left to right. So, it's very interesting when you think about a baby and you think about a remedy called nux vomica, which is generally a very irritable remedy, but it can also be very mild. And we see the irritability in their aversion to being touched. And it's most definitely a digestive complaint remedy with pain and irritation. But, nux vomica can be the sweetest and mildest in their nature as well. So, and we pay careful attention to their irritation in the sense as they're being touched. Then we go to calcarea here, and it's a very common remedy for infants and will serve the child that feels better in the comforting hands of a parent. So they do want security. Security for them is very important in their emotional response. Bryonia. It's irritable. And they're really irritated by being moved around and touched. And then here we see calcarea again. So we see the opposite. It can be both mild and irritable. And still the same aspect to their irritation and symptom is that they are ameliorated or feel better from being touched and cared for. And then we go to the red column, red bubbles, and we see they're eating less. And then we follow the mood. Are they mild? Are they irritable? Meaning mildness means unperturbed, unaffected, sweet even happy and smiling. And we question ourselves, how are they if touched? Are they aggravated? Are they ameliorated? And we've got the choice of remedies, silica and pulse. And we haven't done either of these actually. So silica, they don't want to be disturbed or touched, and yet they are still stoic in a sense with their mood. Whereas a pulsatilla child absolutely needs mama, needs to be held, needs to be rocked, needs to be, they love pressure on their abdomen in this instance. So, but note, this is all a person who is eating less. They're still mild, etc. So then we see nux vomica again. Oh, I missed one. Calcarea and pulsatilla. Oh yes, well, calcarea we already covered. It's very similar, but you can see they have the appetite, can be both diminished and increased. And here we have them wanting to be carried, like wanting to be touched. So then we go to the irritable remedies, irritable states, and we see aggravated by touch, nux vomica, belladonna, and sulfur. So nux is very irritable, but note one thing, they don't want to be cold. They're the baby that wants to be wrapped up and even in a warm place. Belladonna is in pain, intense pains. A keynote of a belladonna is a 1 p.m., between 1 and 3 in the afternoon, where their pain is worse. Whereas pulsatilla is actually an evening time aggravation, where they get the worst symptoms. And then sulfur is, they might have a continuum of discomfort, and they're worse after nursing. So most babies would be a little better during and immediately after nursing, but maybe waiting a while before their pains would occur. And though not chilly necessarily, a sulfur doesn't want to be covered. And then we come to probably the angriest state is chamomile. It's with intense pains. And then aconite is in a very fretful state, restless, afraid. Their aggravation is after midnight, and they're definitely very fretful. They'll be restless and moving, jerking, etc. So this is a little bit of advice on how to use the chart. I will do one more and then just look at them as well. There are websites, then I'll put the link in at the bottom of where to go to read more on a remedy, and I'll give you a very good link for that. It's a free copy of what's called a Materia Medica, and you'll be able to read a very detailed description of the remedies there. So here we have, a chart for constipation. The options are they trying to have a bowel movement or they're not trying? Are they a fearful state or a happy state? That could be also irritable or mild again. You could use that. And so on. They're both equal questions on both sides. And then we go to, are they thirsty or thirstless as a distinguishing characteristic of the remedy we want to choose? And interestingly, some of these remedies are actually more known as diarrhea remedies, veratrum, arsenicum, especially, but they can also have constipation. And it's the state of mind that really tips the point about their use, that they do have constipation in these states of mind. Now, how do you know if your baby is fearful? Well, that's why I mentioned about anxiousness, sensitivity to noise, that sort of thing could be a marker of that. So the nux is, I'm going to read it in order. What's the first one? Veratrum. So they're really afraid, and probably from the pain on account of it being hard and large, and even they're paralyzed by that state, just paralyzed. And that could go for toddlers and young children as well. And then the arsenicum is, they have painful constipation with anxiety. So they're very afraid to go to the bathroom. And then nux is irritable, and they might be pensive, just no way am I going to go. There's no way you're going to get me to sit on the potty. And then for infants, you can't really tell that well, but there may be some indications for it. And then belladonna has, they're really angry about the pain. And they have contractions in their body, and their body is hot. When they're really worked up and hot, you would think of belladonna. Again, they'd be in these categories. They're trying to go, they're too afraid to really push, and then they get irritable and afraid and so on. And the child is generally still eating or not eating. So lycopodium, LYC, has, they have a desire to go but just won't come. The stool is hard, it can be difficult, small and incomplete. Aconite, in the happy child that's thirsty, they can also have urine not wanting to pass as well. They're just not able to pee. And then they have a clay-colored stool. Bryonia, they have a constant urging to poo, and they can't do it. And they have much straining and effort. Calcarea also has that same unsuccessful urge, but their stool, if it comes, is sometimes whitish and egg-shaped. Silica has very hard, very unsatisfactory stools, and they have great effort at passing them. And then sulfur, when constipated, watch for prolapse of the rectum. And so that can be very dramatic. This one, pulsatilla again, they have the same difficult stool with straining, and their stools can be alternating, hard then soft. But remember, this is, adding in. They're trying to poo, they're cheerful, They're not drinking and eating. So that's the pulsatilla state. And then we go to the really not even trying to have a bowel movement. Fearfulness, thirst or thirstless. The thirsty ones get the big list. Chamomile, again, obvious anger and pain. Aconite, the same symptoms of restless, fearful. Bryonia, constant straining. And silica, difficult stools. Sulfur, bad smells might be a part of it. And look for the prolapse rectum. Pulsatilla, again, they're fearful, they're thirstless, and just the same, better when you hold them. Silica, we did. Pulsatilla, again, thirstlessness, cheerfulness. So in either pulsatilla is interesting because you can see it's both happy and fearful. So don't be stuck on one emotional state for a remedy. A remedy can have both sides of a coin. I've put opium here. Opium is a really important constipation remedy. So it could come about from fright or fear. They're irritable, but mostly there's a kind of paralysis in the bowels. And even if you have had to resort to any sort of aid for a bowel movement, it stopped working. And so then we think of opium then. So opium sounds like, well, it's a drug. But remember, it's a homeopathic form of that medicine. And it has a dilution where there's no actual material substance. Very, very nano memory of the material. So again, we're not going to go into every remedy because they're much the same remedies, remember. And here we have teething, their temperament, and this is interesting characteristic to look for, whether their mouth is wet or dry with their teething. That can be a very clear distinguishing factor. In skin rashes, again, this is pretty simplified, but we've got itching. Is it wet and weepy, or is it dry and flaky? Is it not itchy, wet, or dry? And you've got a nice selection of remedies from which to look for possible choice. And then colds, we've got all sorts of remedies here. Let's say the cold comes on suddenly, they're mucousy, they feel chilly or they feel hot, and then if they're dry, in no mucus, but they're chilly or hot, you've got definite choices. And these little flowcharts, you can blend them because perhaps the child has a couple of conditions. Here we have the slow onset of a cold, that it comes on, little sniffly, little scratchy throat, and they go good for a couple of days, and then suddenly they're in for a doozy. So again, same questions, and very simple, very simple. Here we have a little bit about coughs, dry or wet coughs. When they cough, is it worse in the morning when they get up or while they're waking up, or worse at night at the end of the day or lying down? So we see definite easy choices to read through. And so we've got the dry cough or the wet cough. Now, what is a wet cough? It's probably one that's rattling and wet in the sound, but it may or may not be productive where mucus is coming out. Now, there's a group of really common remedies in homeopathy, and I'll just describe them a little bit. So one is spongia tosta, and spongia tosta is made from dried and then toasted or roasted sponge, the ocean sponge. And this yields a high amount of iodine, actually, as well as other minerals. But anyway, homeopathically, we give it, and the indications are a dry cough, a croupy cough, and it's suffocative. So it interrupts their ability to breathe normally. And they go red in the face, that sort of thing. Another really important homeopathic remedy is Rumex crispus. And this is for a dry cough, and it's worse in the cold. If they go from the warm house towards the car to get to the doctor, or to go to the pharmacy to pick up your remedy, they're worse when you go expose them to cold air. Another remedy is called Cuprum metallicum, and that's for a very spasmodic cough, where it just comes and comes and comes and doesn't stop, and it's not necessarily sounding anything more than the whole racking of the chest. That's Cuprum. Drosera rotundifolia is a deep, deep, deep cough, barky sound, and they'll often vomit after they cough. And then it would be wrong not to include a remedy called Allium cepa, which is often given for, hay fever symptoms, runny noses. And this is also like a cough sometimes. It can be irritating in the throat, in the bronchi, and the mucus is really runny and irritating. And one characteristic about Allium cepa cough is that it's worse when they lay down at night. So I hope this isn't dragging on too long, but there is also a little bit of a materia medica for some important indications for the remedies, and some of the causes specifically, and their mental states. So aconite, aconitum napellus, complaints from upset, mental shock, fearful, worse dry cold, and the sudden onset of symptoms. Sudden onset, that's probably why many parents have learned aconite for the first signs of a cold or sore throat. Arnica should be mentioned because it's so important for treating kids, and we think that all injuries could benefit from arnica, but not really. You need to see a sense of shock in the reaction. And what does shock look like? It looks like stoicism. It's like, I'm fine, leave me alone. Meanwhile, they actually are quite banged up. Arsenicum album is a very anxious remedy state. It's restless, it's worse after midnight, like aconite, and worse being alone. So obviously babies aren't going to be left alone, but even for a minute, maybe it does affect them. Belladonna, a wonderful fever remedy, where you might see convulsions. The fever gets high, and they get very hot, and they can be even crazed with rage and hitting, and super sensitive to pain, and even their hands or parts of their chest might be red and hot. Bryonia, a really wonderful homeopathic remedy that treats many, many different conditions, especially fevers and infections. So they're very thirsty. They don't want to move at all. And so sore, they don't want to move. That's the real reason. And colds always go deep into the chest. Calcarea, fearful, shy, obstinate children. They can be a little bit lax in their muscularity, and they'll be sweaty, clammy, and their teething could come very slow. Chamomile, we've always mentioned a lot about that, chamomile's intensity to pain and to temperament. Lycopodium could be a tyrannical child. Really, the temper tantrum state can be very bad. And they're insecure. That's the bottom line that leads them to anger. Nux vomica, super sensitive and irritated. Outbreaks of rage, outrages. Impatience, oversensitive to cold. Phosphorus, we haven't mentioned much as yet. I should have done, but it didn't come up in the couple that I used as an example. Here's a super sensitive individual. They are, so in touch with each person in a room, yet they get draggy and tired, and they do burn out very fast. Pulsatilla, one of the most easily recognized baby states. So they're mild, they weep easily, they need consolation to be comforted. Their mood changes quickly, and here they're very bad for getting overly hot, and they are always better in the outdoors. So Silesia terra, they could be distant, obstinate like calcarea, and we see mineralization disturbances in their teeth, nails, and even hair. And in fact, health food stores sell a supplement of silica in its mineral form. They could have pimples or cuts that get infected very easily, and they're also worse for cold. Sulfur, smell. They look dirty, they have skin problems, and they hate being overheated in bed. And then veratrum, very important remedy like arsenicum for digestive disturbances. And we see prostration, exhaustion. They're cold. This should read vomiting with diarrhea at the same time. So they might be throwing up 1 minute and then having diarrhea the next. So very useful remedy to learn for travel and that sort of thing. Along with arsenicum, veratrum and arsenicum are the real gastrointestinal disturbance remedies causing diarrhea. Okay, so how do we take a remedy? So these are my little bottles that I put together, and if you buy a store-bought remedy, in most countries now, they're sugar balls inside a package. Inside a tube. You get usually 80 or so in that container, and the package will say, take 5 3 times a day. I don't do that. I usually give 1 or maybe 2 in some instances. So basically the sugar is a sucrose sugar, and the medication is in a liquid form, and drops are applied, or mists of the medicine are sprayed onto the sugar, usually in a drum, so that all the sugar is medicated. And it is possible, that a remedy is not medicated and you don't get the dose. So that's always a question mark of where you get the remedies. One thing about a remedy is it has different numbers. Usually in North America, there'll be 30 and 200 are more commonly available. Between the two, it's not as important as the choice of the remedy. So if you only have a 200 available, give a dose. And, I usually give just 1 pill straight in the mouth. Sometimes I'll be putting it in water to make it easy to give a baby. Sometimes if your mum could take the remedy for the baby. So that's a really good tip. And then in the book, we've got how to take it, 1 to 2 granules at a time, dissolve in your mouth away from food or drink. So ideally, sometimes you've got a screaming baby and you're pretty sure it's pulsatilla, and the only way to console the baby is to nurse them. Give the remedy, and then why not nurse them? If it works, it will work. It will work. I remember giving remedies to farm animals in their grain, and it worked fine. So it's really just about getting a clear message. The first dose is really a test of the remedy, and if you're pretty sure of the prescription, you might give a second dose, and if you see that it's working, and clearly it needs to be repeated, that'll be obvious. But if you're not so sure that it's working, maybe just wait 3, 4, 5, 6 hours, depending on the intensity of the condition, and then don't repeat again. If you give a couple of doses and it hasn't worked, it's not going to. You need a different remedy. However, if you're really clear that it helped the symptoms, and that those same symptoms that had been helped have now returned, repeat. So that could be in a very, acute situation. There's no limit to how many times you could repeat. Let's say it's a very high fever with restlessness and a febrile fever where they're just really affected mentally and thrashing about and sort of in convulsions. So if you give a remedy and it's good for half an hour, and then those symptoms return with fever again, then give the remedy again. So, don't be afraid to use it if it's clear that it works. And I always use the example, if you were taking a Tylenol for a headache, the headache went away, you're not going to take it until the headache comes back. And then you would repeat the Tylenol. In a simple headache, I'm not talking about a chronic state of headaches, migraines, that sort of thing. So if you're concerned about the reaction, just stop. Don't give the remedy. Look for advice. And then try and get 30C. It's a safer dosing. Although it's my most frequent dose of remedies. I don't give any, usually more than 30 CH. CH is one denomination. You might see just C or you might see K. They're all the same. The number is the most important. The C's and the H's and the K's just denote how it was made, what process they used. And one way to extend the use of a remedy, because like any medicine, it can wear off. And one way to extend its use is to add a globule or granule to half a glass of water, stir the water gently, and take a teaspoon. And you'll find that that is another way to take the remedy, and it might get a good response again. But after that, you could keep going with the water remedy or get a different strength if it's really the right remedy. And just remember this, a remedy is a dose of a substance that can produce the same state that the patient is in during their illness. So why do we give it? We want to, like that authority figure, confront the behavior of the immune system. And so we don't want to keep pushing if it's not needed. Sometimes the body does take time to recover. If you've had a bad flu and you think of that moment when you start to feel a little better, where you know you're not going to get worse, but you're going to get better, well, you might take 2 or 3 days to recover, if it's been a particularly bad flu. And so we don't want to stir the patient's immune response or their vital reactivity. Over repetition can cause an aggravation. So therefore, if in doubt, simply wait. However, in most of these conditions, a remedy should have a pretty fast effect. You should expect to see black and white change in a few hours maximum. So good responses can include a slight aggravation. So for example, if the child has a fever, it might spike very short term and then start to go down. Falling asleep, that would be the most common good response. And then, of course, symptoms improving. And then bad responses after a remedy, aggravated, lasting more than an hour. That needs to be addressed. Usually it means we have to give a different remedy. Then agitation. So agitation, physical, nervous agitation, spiking fever, and delirium. Again, the remedy didn't work or made things worse. Now, if the symptoms worsen, let's say you just had a cold and you're just fed up hearing your baby snuffle and try to breathe, and then you give a remedy for that, and then suddenly the baby gets a cough. That's also a bad outcome of a remedy. So I want to show you the website where you can get the guide itself. and then have it on, on your computer or print it off. And it's a second edition. First one, I tried to make it a booklet form, but it was too small to read. So this is full A4 pages and easily printed. And also, I was going to give you the, this is a website where you can find let me just make that bigger, where you can find the Materia Medica. This is one particular medica that I really like a lot. It's by Constantine Herring, and it'll take you to the letter A if you have this address. But you could just go to homeointorinternational.org. It's a French website in both English and French and German, and they have done a fantastic job of putting online many, many reference books from our founders of homeopathy, because they're not in copyright anymore, because many of these books are hundreds of years old. In fact, Herring died in 1910, I believe, I'm pretty sure, or 1900. Anyway, Herring, it's more than 100 years ago where he would have written his book, but he's a fantastic resource for learning about remedies when you're looking for one. So that's it. I hope this wasn't too long, and I hope you find the guide useful, and do send me feedback. I love to hear that. So take care. Talk soon.